Okay, because we are very late, so perhaps the speakers can sit if they want. You have seen it's very difficult for either the diagnosis and or the deterioration of the gait of everything. So only one or two questions if you have. Yes.
To Dr. J. Can plantar fasciitis be related to gait defect and ankle sprain?
Is it plantar fasciitis?
Yes, can it be related?
Well, plantar fasciitis will definitely alter gait. I don't have any good evidence to draw the connection between the two. I mean, generally, when the subjects get plantar fasciitis, they tend to pronate more, which would actually kind of, in some ways, be protective against the ankle sprain. So I'm not sure that there is a exact theoretical connection there.
Yeah, sometimes. If it's really unstable, and sometimes you do. We had one on a Thursday just last week. We're in a Premiership team player who'd got supposedly an isolated, on the MRI scan, isolated ATFL, but he'd got a really lax ankle, and you pull on it, and he also, when you got him asleep, you inverted him, he got a big talar tilt. When we actually opened him up, he'd actually got, yes, the CFL was there, but it wasn't. It was deficient. It wasn't functionally there. So it had been stretched, so it looked like it was okay on the scan, but the ATFL had completely gone. And I think that's the other reason why I quite like ultrasound, is that sometimes we've had some chronic, in the ballet dancers, we've had some chronic instability, and they've had loads and loads of physio, but they just haven't got better. And the MRI scans shown on a few cases shown what looks like a normal ATFL. It sits there, it's nice, it looks okay. But when you do an ultrasound scan and you do an anterior draw at the same time, you can see it's not attached to anything. So functionally, it's just completely deficient, and you don't get that dynamic look on an MRI scan.
Can you grade ligamentous injury by ultrasound? And the second question for Dr. Keller, just regarding the healing of the ligament. If you do some sort of like, do you have any like instrumentation for healing process, improve the healing process, making faster to heal?
Yeah, of course you can in ultrasound, like on MRI. So you have a grade 1, grade 2, and grade 3. The grade 1 is only small edema. And the grade 2 is partial tear, and the grade 3 is complete tear. So it's exactly like the MRI classification.
I reckon this one works better. The answer is no, I don't augment it with anything else. I prefer to have as little foreign material in the player as much as possible. So I do an anatomical reconstruction and take the ATFL if it's come off the talus, put it back on the talus if it's come off the fibula, and it often comes off as a sleeve of the ATFL and CFL. They come off as a sleeve and come off, and we put them on. And like I said, I try to use interosseous sutures rather than bone anchors to limit artifact later on. I know there are some augments out there. You can use some augments to reconstruct it from the tibia down, from the fibula down to the talus. I'm just uncomfortable with leaving too much foreign material around. I think it'll cause a reaction, and as yet, no. There is talk about, I did talk to Freddie Fu about this, get quite an entertaining conversation about PRP. I don't use it. I think what's there is pretty good in the acute stage. So I just do that.
Okay, thank you, everybody. We have to stop, and you can ask your question to the speaker if you want, and we have to eat. Thank you very much.